Good afternoon. Thank you everyone for joining us. We've just come through 4 days of a very long weekend, and it has been relatively uneventful on the COVID-19 side. Locally, we haven't seen an increase or a significant increase in the number of cases. Just a couple of more have been tested positive. There have been some other challenges locally though, and I'm sure I'll have some questions about that as we get to the questions part. One of the things I want to talk about though in particular is PPE, the personal protective equipment. There has been a concern from a number of people, rightly so, that Ontario doesn't have enough PPE available. So I want to give you an update on what's happened over the last 6 days. The Ontario Together portal is working. I have people who are making donations. We've been able to source a large amount of PPE. I want to give you an update on what we have been able to resource, what we've been able to source in the last 6 days. 13 million surgical and procedural masks have come into Ontario. 200,000 N95 respirator masks and 38 more ventilators have been delivered to Ontario's pandemic stockpile warehouses. Now, for those of you who don't know, our warehouse is the central repository of all of the PPE that's coming into the province. Each of our long-term care, healthcare, and frontline services are reporting on a daily basis what their inventory is. And we're able to send product out to them as they need it. We're making sure that no one is going to be running short on PPE by doing it this way. And in some cases, we're able to deliver product to them the very same day that they're reporting their stockpiles are getting low. We've had a number of different companies who have stepped up and answered the call, and we're seeing the results of it. Locally, we've had companies like Harco, Merit Precision Molding, and Siemens, who have been putting together the face shields. A large donation of face shields from Harco went to one of our long-term care facilities here in Peterborough just this past week, on Thursday, I believe it was actually. We have been making a difference locally. Kawartha ethanol has now been approved by Health Canada to make disinfectant and hand sanitizer. They have the ability of producing almost 90,000 liters of it on a daily basis. We're now in the process working with the province to source bottles that they can use for it so they can be shipped wherever it's needed in Ontario. They've also entered into an agreement with a company in Niagara Falls to provide them with ethanol so that they can also produce more hand sanitizer. Local companies have stepped up and they're doing a lot of very good things. We're still asking for people who can produce or who have the ability to source some of this product to please continue going to the Ontario Together portal and do it. What we're really looking for, what our critical needs are the N95 respirators. They can be the ones produced by 3M or any other N35 respirator that is NIOSH certified. We're looking for isolation gowns, both level 2 and level 3, AMI certified or FDA certified gowns, and thermometers. Those are where our biggest needs are at the moment. We do have stock here in Ontario right now, but we can't have too much of it. So we're asking anyone who has the ability to source this, anyone who has the ability to produce this, please go to the Ontario Together portal, put the information in so that we can distribute it where it's needed most across Ontario. Earlier today at about 1 o'clock, the legislature resumed for another emergency session. What was on the docket today was Bill 189, and it is extending the emergency declaration for another 4 weeks. We'll be touching on things like education, making some of the changes that need to be made there to last for the next 4 weeks with it. With long-term care facilities, with healthcare facilities, all of those areas where healthcare needs to be addressed and they need to have that declaration of emergency extended or all being extended as part of this. Ontario has done very, very well at reducing the number of infections. What we saw over the last week was consistently a reduction in the increase by percentage. In March, we were looking at almost 17% increase on a daily basis. By a week and a half ago, we were down to a 10% increase on a daily basis. And this past week, the past 7 days, every single day, it has been below 10%. We have been sitting at around a 6% increase the last 3 days. This is good news. It means that the social isolation, it means that the physical distancing is working, and we're starting to get ahead. We need to continue this diligently, though. Make sure that we don't become complacent and don't start going out when it's not necessary. We can't emphasize it enough. The more people stay at home, the more likely the virus will not spread. I'll open up the floor for questions. Please raise your virtual hand if you have a question for me. Matt, go ahead.
First, do you know specifically what Peterborough needs the most for PPE?
In terms of what we can produce locally, or what each of the individual locations need?
Just basically like an overarching number of like, or not necessarily number, but they need like masks more, or they need ventilators, or blah blah blah.
So our hospital is in a good place with ventilators right now. We don't have a shortage of them at Peterborough Regional Hospital. What we always need, though, are the N95 respirators and surgical masks, as well as the isolation gowns. Those are the three things that are used the most. We seem to have a good supply at the moment of surgical gloves, but we can never have too many of those. If there is someone who knows where they can get any of those products, please go to the Ontario Together portal. Let us know so that we can get that information out and we can get those products out to the people who need it. We've been making sure that no facility has less than a 7-day supply. And I think as long as each of those facilities continue following that protocol and continue putting their daily inventories in, make sure that no one runs short.
All right, thank you.
Any other questions? Okay, I don't see any other questions. Thank you very much for coming on. Oh, Matt, go ahead.
Sorry, I just raised my hand. I wasn't. I don't know how this thing works half the time. I do have one question. Do you know the specific numbers for the drop in COVID cases in the Peterborough area?
For the drop in COVID?
Like you were saying, how the social isolation has been working in Ontario. I wasn't sure if you might have the numbers to say like how it's working in Peterborough.
So we didn't do projections based on each of the individual regions.
Okay.
Did projections across all of Ontario. But if you take that and extrapolate it, we were looking at in the neighborhood of 600 deaths across Ontario as of last Thursday. We were only at 250. If you translate that to where we would be in Peterborough then, with the population of Peterborough, we would likely have been in the neighborhood of 5 or 6 deaths. We had our first death this past weekend, so we are doing better than most because of that. It's a tragic case. Someone has passed away as a result of it in our community, and my heart goes out to those families. Peterborough is in very good shape, and I think a lot of the credit for that has to go to people who have taken seriously to social distance and the fantastic work that our frontline healthcare workers are doing. The hospital has been doing yeoman's work. All of our long-term care facilities have implemented the lockdown appropriately, and they've come up with plans to isolate within their own facility if someone is diagnosed with COVID-19. We have had diagnosis at a couple of the long-term care facilities, but it has not spread within those facilities. So you have to take your hat off to those frontline healthcare workers who are doing the work to to ensure the safety of all of those residents. And if we stay diligent on it, if we continue down that path, if we make sure that we follow physical distancing, we're going to be in good shape here locally.
Awesome. Thank you.
Any other questions? Thank you very much for coming on again today. And sorry, I see that Warden Jones has joined us. Warden Jones, do you have any comments that you'd like to make?
No, thank you again for allowing me to join you. I guess my biggest bugaboo lately has been the influx of comments about cottagers coming up to the area. And I've certainly been battling that by email and all kinds of different ways. But I think my story is the same and always has and always will be, that this is not about ignoring their contributions with their tax dollars. It's not about not welcoming them to our community. It's about saving somebody's life. And that's what we're sticking with, and we've got to get everyone to cooperate.
Thank you, Warden Jones. All right. Thank you very much for coming today, guys. And I'm sure we'll be doing this again tomorrow. Have a good day.